So the next speakers are actually part of the organising team who have also been very interested in sustainable health systems for many years. So Yvonne Zurynski is Associate Professor for Health System Sustainability at AIHI and the co-lead for the Observatory on Health System Sustainability within the Partnership Centre. And Kaylin, really Carolyn Smith, but we all know her as Kaylin, is a research fellow with the PCHSS and also with the New South Wales Roots and Shoots. She's the New South Wales Roots and Shoots coordinator for the Jane Goodall Institute. And if you want to talk about the Jane Goodall Institute with Kaylin, you're most welcome to contact her directly. Welcome, Yvonne and Kaylin. Talk to us.
Thank you very much, Jeffrey. Can I just check that you can see my slides as they should be, or are they strange?
Check.
All good?
All good.
Okay, perfect. So I'm going to do a very brief presentation about increasing sustainability through integrated care. So I'm a health services researcher, and I think about systems and the way that health systems and services are organised. I think there's a lot to gain through reorganisation and integration of our health system. As Lucy and Leslie and others have already mentioned, the prevalence of chronic conditions in Australia is increasing, and this is very likely to be exacerbated by climate change. There's no doubt about that. And people with chronic conditions need care from many different health professionals. They require regular monitoring, pathology tests, scans, procedures. And because of this, they have difficulty navigating the health system, which is still very largely siloed. We still deliver care that looks like this in this diagram, where the patient may be at the centre, but they're actually accessing different providers and different services separately. And there's very little connection among those different providers and different services. And so what you get is convoluted care pathways, or the runaround, and many needless repeated tests, imaging, multiple appointments in multiple locations. And that's because of that limited shared care planning, limited interdisciplinary care, and shared medical records. So the International Foundation for Integrated Care advocates for care integration, and much of the medical literature talks about the benefits of integrated care in terms of better experiences for people, families, and caregivers, and for service providers and clinicians, better cost efficiency and effectiveness, or better value care, and improved health outcomes for the population. But what about environmental benefits? There actually isn't a lot of work done around that. I want to tell you about an example of an integrated care model developed to improve care and experiences of children living with chronic conditions and their families. So these are children who need large specialist teams to look after them, especially those living in rural areas. And so you can see this family was travelling to a Sydney hospital every couple of months just to have their child's blood test results reviewed. We can do better than that. We can do it in a different way. So a child-centred co-designed integrated model was developed, which included networking and communities of practice with continuous learning for everyone, including staff, parents and families. There was a dedicated care coordinator with a single point of contact. Parents could access a phone support line. There were cross-sector partnerships, which are so important. Telehealth consultations were also part of the model, but didn't replace face-to-face care. And shared care plans were really, really important so that all of the providers were on the same page. And this also avoided that runaround. In addition, there were other benefits. About 50,000 kilometres in travel for families was saved. There were averted ED and day-only admissions recorded, so by about 40%, and about $2.4 million in costs based on admissions alone were averted. So this also has environmental impacts. And as we have seen at the COP26 meeting, many countries, but not Australia, have committed to creating climate resilient and sustainable low carbon health systems. But how this will be done to meet these commitments is currently uncertain. And I wonder whether models of integrated care may help us to meet these targets. And of course, as Tony mentioned, and many others have mentioned, we really need to measure the carbon footprint of the health system to understand the impacts of the changes that we make in the way that the system is organised.